Wes, thanks for coming and trying out the LumbarTrac today. Can you tell me about your back pain? How long has your back hurt? What have you done to try to relieve the pain?
Sure. About 2004, I had an injury on the job. I was moving logs and I blew out 2 discs in my back, L4, L5, L5, S1. I had a discectomy and laminectomy done. And the pain was pretty incredible. My leg went limp. I was dragging my leg around. I spent 9 months on the couch. I didn't lose any other functions. I have 8 children, so like life went on. But yeah, I dealt with pain for quite a long time. And 2 years after I had that surgery, which gave me tremendous relief, I got about a year out of it before I got full function of my leg. But I blew out the same 2 discs again just a few years later, and they wanted to fuse me, and I refused to be fused because of my age. And I figured I'd hold out as long as I could until, because of my age, I wanted to hold out as long as I could, because once you get a fusion, they say that only 1% of people recover, and you're just going to snowball and just keep getting surgery after surgery after surgery. And I was only around 30 years old. I didn't want to do all that. So the pain was pretty intolerable for an awful long time. I took every narcotic that they threw at me, and those things are only good for one thing, and it's not for controlling pain. And I used to put myself on exercise balls and on hardwood floors. But eventually the disc reabsorbed, but it's never been the same. So right now it's several years later. I still have some degree of pain all the time, and I just took a long trip recently, so 12 hours in a vehicle jacks me up for days and days. But I don't treat it. But what is there? You know, there's no drugs that you can take. There's no surgery that you can take. There's nothing that I can do that has been like that. There's just been nothing.
Yeah. Yeah, and I found that same thing. There's no guarantees with the LumbarTrac, but the whole concept is if you're getting pain from compression, you're disc compressing together, this just very simply and gently, but with all the force you need, pulls it apart. So let's give that a try.
Right away you can feel how taut it is in my back, but it's not a bad thing. It's actually warming, and that means blood's flowing down there.
How does that pull feel?
It doesn't hurt. It's not to a point yet where I can...
We don't want it to hurt.
Nope. Now right there, that pull, it just hit a point where it's almost a relief. I'll call it a relief.
It should be a relief. Now hold it there and really work on relaxing those muscles. And you can do that knowing that you're not going to get a sharp jar from a machine. And just take your time and relax it. You can back off of it if you need to.
No, I like it. I like it right there.
Wiggle. You can wiggle your hips around. You can pick them up off the bench and wiggle them.
That's even better.
We just want to gently stretch those discs back out the way they used to be before they impinged your nerves.
Yeah, that's pretty nice. I'm not gonna lie, that's pretty nice.
Hear that a lot. I found it to be an addictive feeling.
Yep, if I had one in my house, I think I'd be on it at least every other day. Yep, no good there. How long do you lay here and just let it?
When I first started, I would stay on there 10 to 15 minutes because it would just take that long to slowly stretch it out. But now I'll get on it for anywhere from 5 to 10 minutes. And if I'm lying on the sofa watching television and my legs start to tingle or get numb in a really frustrating way, I'll get on it for less than 5 minutes. It's almost instantly, as soon as I start pulling, the tingling goes away.
See, I hit a point where I was ready to stop and didn't want to go further.
And it pulled out, it stretched itself.
Yeah, I let it go, and now I'm ready to pull a little tighter.
You'll probably be a couple inches taller when you get off.
That's good, because I really lost a half an inch. I really did. I was 6'2", and I was 6'1.5". Yep. I like it better than the ones that the physical therapists offer with the motor.
Oh yeah, that's what led me to build this one.
Yeah, that filled me with anxiety when it was tugging on me. It really did.
They strap you in almost to a claustrophobic way, and then they punch in an arbitrary number, let's say 160 pounds, and then they walk away.
Yeah,
And then it's going to pull.
Yeah.
It's going to pull 160 pounds whether you're ready for it or not. And I found that, you know, in the short sessions that I would have, if it was pulling too hard, I would fight it the whole time. So I couldn't get, you know, the efficient therapeutic relief
Yeah.
I was looking for. And if it was set too low, it didn't do the job.
Yeah, that's that anxiety. If you have the anxiety and you're fighting it, then you're doing muscle damage.
Mm.
That can't be good. And no, I have no stress sitting here. Yeah, it's been a minute since I've been able to. I could feel the blood flowing down there, and I could feel it flowing through my legs differently now too. You know, it's funny because all the kids are in karate. And they know how important it is to stretch, and I tell them all the time they have to stretch. But I'm not doing it myself.
Do what I say, not what I do.
Yeah, pretty much. It's the job of a coach, right?
Yep. Well, if we all did what we were supposed to do and ate the things we were supposed to do and do all the stretching that we're supposed to do, we probably wouldn't have any back pain.
Right. Are you recording every second of this?
Yep.
Yeah, it's a lot different than the inversion tables too. I had gotten on one of those.
How'd you like that?
I hated that. I had only done it twice. The first time I thought I liked it a lot. The second time that I got onto it, it put me through an awful lot. I ended up in the emergency room. So because of that incident, I was really apprehensive for a long time about doing anything at all. So I just bit the pain, you know.
Mm-hmm. How'd you like feeling hanging upside down?
Well, I didn't love that. I don't know anybody that loves to be upside down, but because of the first time I felt some relief, but it's unpredictable because the second time it brought tears to my eye. And I'm not somebody who cries over pain, but I cried over that kind of pain.
It just pulled the wrong way?
Yeah, it sure did. And it's not suddenly jarring, but it's fast enough that you can't compensate, you know.
Mm.
You can't just stop 3/4 of the way down. That thing has a tilt, and once you hit it, you're down. I keep expecting something that, just from the past doing things I'd have apprehension about, getting back upright again and letting the compression off my spine, I expect to feel something hurt in the nut.
That sounds good.
Yeah, it's good.
I don't have any pain, but I can feel the blood. The blood flow is important, and I feel that blood flow in there.
And no pain.
No, I don't have any pain.
You had pain when you first started,
I did.
and it went away.
I don't have that pain anymore. I do not.
That is very nice.
But I do feel the stretch, and that's like, but that's standard. When you stretch, you feel that you've been
Yeah.
stretched, and that's what I feel. But I don't have that nerve thing that was bugging me from the trip.
So based on your experience here, would you recommend this to other people that has lower back pain?
I would. I would recommend this thing, and I would put it in my own bedroom. I would use it. I would use it.
Thank you very much, Wes. I really appreciate it. I really do.